So our guest on the show today, a 67-year-old retired senior executive, was finding his journey to a proper diagnosis and treatment of his enlarged prostate quite challenging. Frustrated by the lack of trust and options after meeting with several providers, he began to realize he needed help. He needed a prostate health coach. We are excited to have him on the show today to share his journey and how the Prostate Health Academy gave him the tools he needed to confidently navigate the process. So stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is a question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pohlman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm excited to have joining us on the Prostate Health Podcast today, Tom. He is a retired senior IT executive with over 40 years of experience leading transformative technology strategies for global organizations. Specializing in driving business growth through innovative IT solutions, he had provided global IT leadership at Fortune 500 companies across a variety of industries, including financial services, retail, media, manufacturing, chemicals, and pharmaceuticals. Despite his business success, he was not immune to the struggles from an enlarged prostate. But not surprising, considering 70% of men over 60 years old suffer from BPH. We are definitely excited to have him on the show today to share his journey with BPH and how a prostate health coach was an essential component to his journey with an enlarged prostate. Tom, welcome to the Prostate Health Podcast.
Thank you, Dr. Pohlman.
So, how did your prostate journey begin?
Good question. Over the past 25 years, I faced various prostate-related issues, ultimately being diagnosed with an enlarged prostate and benign prostatic hyperplasia, BPH. My journey to find the proper diagnosis has been very, very challenging, marked by multiple encounters with different urologists.
Could you share with our listeners what some of your symptoms that you've been dealing with over the years have been?
Absolutely. Urinary urgency, frequency, weak stream, dribbling, needing to urinate shortly after just going, and getting up several times at night.
And just kind of talking about some of that in terms of getting up several times at night, I mean, how has that affected your quality of life and your day-to-day life?
The day-to-day life has been very, very disruptive. Getting up 5 to 6 times a night is not fun, and you wake up very, very tired. Additionally, it's problematic once you go to the bathroom and then 5 minutes later you have urgency. Nothing is really happening. You go sit down again and you have to go again. So it's a vicious cycle that affected my lifestyle.
And with some of the symptoms that you've been having over the years, certainly I'm becoming more annoying, which ultimately I'm sure led you to go see various physicians. Could you highlight some of the different treatments that you've tried along the way and kind of how those have worked for you?
Absolutely. So the treatments that I've tried different medicines. I've tried Rapaflow, which is Silidocin. Some people that are listening may have heard of Flomax. So Rapaflow is a competitor. I was also prescribed Tadalafil, a low dose of that. Additionally, I was told to take certain supplements and so on and so forth. And to be honest with you, I didn't notice much relief at all. I know some people do, but I didn't.
We appreciate you highlighting some of your symptoms, which I think is important for our listeners to hear that. I mean, one of the biggest myths that I tell patients is that now, particularly when it comes to an enlarged prostate or BPH, is that experiencing symptoms of BPH, such as you mentioned, the weak stream, frequent urination, dribbling, getting up at nighttime to go to the bathroom. One of the biggest myths is that this is just a normal part of aging. Well, this is a myth, is that while BPH is very common as men age, it is not normal, and you do not just have to put up with the symptoms. So what have been some of the challenges you have faced in navigating your BPH journey?
Another good question. Well, I saw 3 different urologists during my journey with BPH, struggling to find a provider whose approach to diagnosis and treatment aligned with my needs. Many of the doctors recommended what I would describe as the $1 million examination, involving numerous tests that upon further research discovered were often unnecessary. And I learned a lot of that from the Prostate Academy, which you founded, Dr. Pohlman. The treatment offered by several urologists were generally limited to only what they offered in their practice. I, as a patient, thought that all doctors, for the most part, offered similar treatments, but that is certainly not the case. So one of the things that I would want to share with the listening audience is that you definitely need to find a doctor who can perform a comprehensive review of all available options. One urologist was pushing UroLift, for example, as the only treatment that he would be able to offer. But how I quickly learned that a one-size-fits-all approach was not suitable for my condition.
Well, and I'll just briefly comment here. I think when it comes to management of an enlarged prostate, there is certainly not a one-size-fits-all approach. And when patients come to me seeking relief for their urinary symptoms, the options we explore are really determined by a myriad of factors, like how big is their prostate, what is unique about their anatomy, is there a median lobe or a middle lobe present, have they had previous BPH interventions or treatments, how severe are their symptoms. Unfortunately, I think we still have a lot of our urology colleagues still trying to squeeze the majority of patients into just one particular treatment, maybe the one that they just offer in their practice. I think as a whole, we need to do a better job of finding the right treatment for the right patient. And it's not that you have to offer every BPH treatment that is currently available, but if the patient's personal preference and their anatomy is drawing them to a treatment you don't offer in practice, to be able to get them to one of your colleagues who does offer those options. So after seeing numerous urologists now, you've underwent numerous tests and treatments, including medication, supplements. How did you proceed from there?
I became very, very frustrated. And as mentioned earlier, I went onto the internet to become my own doctor, which is not what I recommend to anyone. And it was really to be my own health advocate. And I ran across the Prostate Academy, and it was something that I felt would help me because it was folks like me that are dealing with prostate-related issues, and they post what they've been going through and so on and so forth. And additionally, someone like you as the moderator oversees many of these comments, and it allows a lot of the participants to ask a question. And that's how I became educated. And it was during this search, as I mentioned, that I discovered the Prostate Health Academy, founded by Dr. Garrett Pohlman, yourself, a leading urologist. And I'm very, very happy I did. A lot of people out there are on their own when they are dealing with multiple doctors, and you're at a disadvantage because you trust the doctor. But I felt being a part of the Prostate Health Academy, I had a group of people like myself that are dealing with prostate-related issues. We have you, Dr. Pohlman, ask questions to learn and educate ourselves. So it's almost like I have many friends of the family that I could reach out to get a view on things.
Well, we appreciate you sharing that. And could you share with our listeners, maybe in detail, in terms of how has the Prostate Health Academy helped you in your journey?
The Prostate Health Academy provided an invaluable platform for learning about prostate health. It covers everything from BPH to prostate cancer, offering resources such as interviews with leading urologists. It also has a comprehensive library of articles, a community forum where members can ask questions and share experiences. The Academy also allows members to communicate directly with you, Dr. Pohlman, as mentioned, for educational purposes. For me, it was the best decision I made in my journey toward a better understanding of my condition and treatment options. Additionally, the Academy empowers individuals to become informed patients and advocates for their own health, making them better prepared when meeting with their urologists and having more meaningful, informed discussions about their treatment options. As a result of my participation in the Prostate Health Academy, I was better prepared in finding a urologist I felt comfortable with, who offered a range of non-invasive BPH treatments. And through this process, I'm able to make an informed decision with the urologist about the treatment that was right for my anatomy to meet my treatment goals and personal preferences. Once I did find the right urologist, I did learn that there were some pitfalls with my challenge of finding the right doctor over time, whereas my bladder started to begin to thicken. So now I'm not only just dealing with my prostate, you're dealing with the bladder, because the bladder is a muscle, as I learned in the academy, that works. Like any muscle, if you work it over time, it gets bigger and less flexible. And ultimately, that will cause me a problem with urination.
Well, we really appreciate you sharing some of that. And for me, it has been very rewarding to hear stories like yours from Academy members who continue to find value in the Academy. After I started the Prostate Health podcast, while men appreciated having these episodes that were in finding value in the information, what I was hearing from a lot of our listeners was that they needed even more personalized coaching, needing to dive in even deeper. So I decided to create the Prostate Health Academy. And really, it was designed to equip men and their loved ones with the capability to leverage an online resource to not only prepare for your physician appointments, but also validate their physician's recommendations. Many individuals don't even know where to start when doing research on their condition and want to avoid wasting hours sifting through the endless sea of information on the internet. Also, there's a lot of misinformation and bias regarding prostate health on the internet. For example, on YouTube, it is reported that 87% of videos on prostate enlargement or BPH and 77% of videos on prostate cancer contain misinformation. So that's why I created in-depth lessons, resources within the Academy to cover all aspects of prostate health. In addition, included in the Academy is the private community, as you mentioned. Really, I feel it's the heart of the Academy, where you're able to, like you said, surround yourself with like-minded individuals who understand the journey you're on. I'm also in the community providing feedback and support. As you mentioned, members are able to ask questions to me as well, get feedback, as well as getting to know other individuals, sharing your journey. So I guess you can think of the Academy as your personalized prostate health coach, so to speak. So there's certainly a lot to sift through, even after an initial consultation with your urologist, Tom, and what to make of findings from your PSA, as well as particular findings on various tests, including biomarkers, prostate ultrasound, uroflow testing, and MRIs that were done. Could you share with our listeners how having a prostate health coach with the Academy, so to speak, has helped you navigate the results of some of the tests that you underwent?
Absolutely. As I mentioned earlier, many of the doctors provided $1 million exam. I went through every test, and certainly they're not fun. And as I learned through the Academy, based on my particular situation, many were not necessary. So if you don't have good insurance, I happen to have it, but let's say you're out there and you don't have good insurance, going through many of these tests, which are unnecessary, is going to hit your wallet. And quite frankly, by belonging to the Academy, it's an investment in your health. And you could ask questions about what tests are normal. I received these results. The doctor said this, but I read about that. What's your thoughts? And you get answers to that. I mean, for example, I was even put into a situation where in my case, I had a very low PSA. My PSA has never gone past 1.4. Okay, that's very, very low. And I went through one of these tests and they said, oh, we saw a lesion. And any qualified urologist would have said, based on what we're seeing here, it's nothing to worry about because the lesion was so small. But I went for a very expensive prostate MRI only to validate that it was BPH. And the urologist actually said, I'm not sure why you actually came here for the MRI. So there's many of these things that do pop up when you do go through the test and they use words like prostate lateral lobe obstruction and you don't know what that is and you want to get some clarification because perhaps the way that the doctor described it wasn't well enough. This is another thing that you can pass on to others within the academy and get responses. So I know I don't want to take up the whole podcast about the amount of questions that I posted on the academy and received well thought out answers. But I could tell you from my perspective, I was investing in my health, and being a part of the academy, in my view, is certainly worth someone's time just to take a look at it, because you want to make sure that you're making the right decision. And I'm not saying this to sound funny, but you only have one lower extremity. You want to make sure that you're doing everything you can in the right way.
We appreciate you sharing that. I think it is important to really, your good urologist will explain what they find. But with that being said, it's a lot to take in, especially at the time of your procedures or these evaluations and the consultations. I mean, you're getting a lot thrown at you. And sometimes I think it's just helpful for men to just kind of regroup. Okay, what just happened there? What did they find? And okay, I've got a copy of their notes. And because there's so many different options out there, and you really got to tailor it to your prostate size, the shape, and your personal preferences in terms of sexual preservation and maximizing symptom improvement, trying to get you off your medication and get maximal improvement. So it's a lot to take in and a lot to consider when there's not just a one size fits all. And so I think it is important to have kind of a coach, have the academy there to help feel good about your decision, to help kind of make sense of all of the tests. So I do appreciate you sharing that. And lastly, could you give our listeners an update with where you're at now with your prostate journey?
Absolutely. So after finding a doctor that worked for me and met my requirements and needs, I've decided on a treatment called aquablation, which is in line with my anatomy and personal preference. So I'm looking confidently and moving forward with treatment. I have a date. It's July 18th. I'm looking forward to it. And I'm sure I'll be going back to the academy to ask people who have gone through this procedure to give me an unfiltered view of what they went through after the first week or two. That's something that I would certainly be interested in. One thing that I would like to share with people that are listening to this podcast, you may think that you need a very, very large prostate in order to have BPH. My prostate, compared to some of the ones that I've heard being quite large, mine's about 46 cc, 47 cc. However, the two halves of the prostate are very, very close together, squeezing onto the urethra, which is causing me an issue. So having said that, aquablation, for example, can address my issue for the size of my prostate effectively. And I went for that treatment for several reasons. One, it was something that I felt comfortable that it's going to last me a bit longer than many of the other treatments. And additionally, I felt it was a more thorough treatment in my case.
There certainly, like you mentioned, are a lot of nuances to consider in sorting out through all of the various treatment options. And it really is important, again, for men to understand the various results of their tests, how that plays into what options are available to them based on their anatomy. And historically, I think urologists have downplayed some of the side effects of BPH treatment. And unfortunately, many still do. But the reality is that men care about them. At one time, if a patient realized an improvement in their flow rate and a decrease in their symptoms, we considered it a success. But today, patients are really more vocal than ever in demanding options that minimize the side effects, and especially ones that negatively impact things like sexual and ejaculatory functions. So any final thoughts or words of wisdom today for our podcast listeners?
Absolutely. So I just want to emphasize once again that my involvement with the Prostate Health Academy led to several key insights that helped me make better decisions about my prostate care. So if there's something that I could share with the listening community out there, seek a urologist with a range of treatment options. Don't settle with a urologist that offers you perhaps one or two treatments. It's important to find a urologist who offers a variety of prostate treatments, not just one. There are many options available, and a comprehensive evaluation can help determine the best course of action. Don't settle for a provider who pushes a one-size-fits-all treatment. Also, be proactive about your health. If you're being asked to undergo tests you don't understand or a fee may not be necessary, it's your money. Don't hesitate to ask questions. It's your body, your health, and you deserve clear answers. Being proactive about your medical care ensures you make informed choices and feel confident about your treatment path. And one last thing that I would like to share, for those of you who may be on Flomax and Tadalafil and so on and so forth, and you're still having symptoms, medication is great, but in some cases it's a Band-Aid and it's hiding something. So in my case, when I was taking medication, and it really wasn't a silver bullet, and it wasn't 100%, over time it affected my bladder, as I mentioned earlier. So if the medicine isn't working, go see a doctor.
Well, we appreciate you being here today. And for anyone interested in signing up for the Academy, just go to www.prostatehealthacademy.com to sign up, and we'd love to see you there, help you out. We'll also have a link in the show notes here at the end. So I know I can speak on behalf of all of our Prostate Health Podcast listeners today that we're very appreciative for you coming on the show today and sharing your story. Definitely very valuable information, which will help empower the many men and their loved ones that listen to the podcast. So thank you again.
My pleasure.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.